Hi guys, it's Mona and I'm here with Dr. Aliabadi. Today we are talking about PCOS. I'm really excited to dive into this topic because so many of you asked me about it. We're going to go over causes, symptoms, treatments, all of that stuff. So make sure you watch the whole video through so you can get the skinny on PCOS. Okay, so let's talk about PCOS. I feel like this is something I really wanted to talk to you about because so many people reach out to me with hair loss symptoms, weight gain, mood swings. So let's just go through the basics and first explain what it is.
Good. So polycystic ovarian syndrome, we call it PCOS, is a very common condition. It affects 6% of the population, women, in their reproductive age, which is pretty significant. And it's associated with elevated androgens. Androgens are male hormones. We all have male hormones to a certain level in our system. And most of it comes from our ovaries, and adrenal gland. But for this 6% of the population, they tend to have an elevated androgen. And so they end up complaining to you about their symptoms. In order to diagnose polycystic ovarian syndrome is a group of symptoms. Number one, hair loss, which is mostly male pattern hair loss.
Okay.
Acne, facial hair growth, body hair growth, irregular periods, painful period. Most of them are associated also with depression. Weight gain, which is associated with their insulin resistance. So it's a group of symptoms. You don't have to have all of it to be diagnosed with it. And most of the time in my practice, it's a clinical diagnosis. But in 2013, the Endocrinology Society basically had a diagnosis criteria, and you need to have 2 of the 3 following symptoms. Symptoms of elevated androgens, which we talked about, irregular periods, and PCOS looking ovaries on ultrasound.
Okay.
So if you have 2 out of the 3, you can get the diagnosis.
And can you just check your androgen levels, or it's just the symptoms of high androgen?
You can absolutely do it. But some patients have all the symptoms of PCOS, and when you look at their androgens, it's within normal limits, but that doesn't mean they don't have it, because some patients have androgen sensitivity.
Okay.
That's why 2 out of the 3 criteria is enough. One of the biggest misconceptions with PCOS is because of the name. The name is very confusing. It says polycystic ovarian syndrome. So these patients think when they come in, they should have big cysts on their ovaries. It's not true. It's actually an ultrasound finding, which I call it sac of pearls. So their ovaries tend to be a little bit larger with these semi-stimulated little follicles. So just like a sac of pearls, you don't really see these big cysts on them. It's a bad name, and I think the name should be changed. But
sac of pearls sounds nicer.
Sac of pearls sounds nicer. That's what I use. So it's not like they have big cysts, but they have these specific ultrasound findings.
So do you feel, because I think a lot of people find that it's, at least what I've heard complaints are, they don't know if they're diagnosed with it. People have a hard time. Do you have a hard time diagnosing it?
No. I walk in, I open the door, I walk in, and I know my patient. I haven't even talked to them. I don't know who they are. I don't know their age. I know nothing. But when I walk in, I know they have polycystic ovarian syndrome. The signs of it, so, one way to look at it, let's say you're 30 years old and you're battling with acne. And I'm not talking about acne for 1 week and it's gone. This is ongoing acne issues, scars on your face, male pattern hair loss, being overweight.
And male pattern just on the top of their head.
Right here.
Okay.
So when you're talking to them, you see that they're thinning out. And usually I walk in and the first question I ask is, do you have irregular periods? And they're like, yes, how'd you know? I'm thinking to myself, I know because I know what your diagnosis is. So you don't have to do an ultrasound, and I do a hormone test on the patients that I suspect PCOS.
Okay.
But if you have enough symptoms, we just treat. One thing you have to understand, the process, it's hard to, I think, once again, just like endometriosis, if you understand why it happens, you understand why we treat you the way we do it.
Right.
So just to give a quick overview, and I'll try to make it very simple for the audience to understand it, is majority of patients with polycystic ovarian syndrome suffer from insulin resistance. Insulin resistance is the same condition that causes type 2 diabetes, right? So when you and I eat carbs, right? If we don't have, I'm sure you don't, I'll speak about you because I know you don't have insulin resistance.
No, I'm actually insulin sensitive. I mean, I'm so good that carbs are good for me. Like, it's a different kind of, it works for me.
So when we have carbs, when we have sugar, it goes into our system and it stimulates our pancreas to release insulin. That insulin stimulates our skeletal muscles, our cells in the body, to uptake the glucose from the blood and turn it into energy. Does it make sense so far?
Yep.
So that's what happens, let's say, in you. A patient with insulin resistant, when the blood sugar goes up and the insulin gets stimulated, the receptors, the easiest way I can describe it is the cells do not respond well to this insulin. Right? So the receptors on these cells don't respond very, very well. So what happens, this glucose is not being taken up into the cells. So it stays in the blood.
Just floating around.
It goes back to the pancreas. It causes more insulin release. It's like a vicious cycle.
Because we're like, this blood sugar isn't going anywhere, so they just keep releasing more insulin.
And we keep eating, so it adds up, more insulin. When the insulin levels go up, a couple of things happen. Number one, our body says, wait a minute, I got to do something with all this blood sugar, right? So it turns it into fat, number one. They get overweight.
Yep.
Number two is it stimulates our ovaries to secrete testosterone, which is crazy. This is what people can't understand, and I'll tell you why. So when you have this elevation of insulin, now you're turning all this glucose into fat, and your ovaries are starting to pump testosterone. When you have elevated testosterone, the number one thing that happens is it negatively inhibits your brain to go through the ovulation process. So by negatively inhibiting your brain, which is another cascade, I'm not going to go through all of that right now, patients stop ovulating. When you don't ovulate, what happens? You don't get a period.
Yep. And how irregular will these periods be? Like,
you can have 2 a year. You can have 6 a year. It could be completely random. Okay, so it all depends on your testosterone levels.
Okay.
So now this, elevated insulin, elevated testosterone, irregular periods. But the elevated testosterone causes cosmetic issues, and that's why you hear about it, because of, what you do.
When people reach out, of course, like, you're a woman and you care. You know, like, I'm breaking out. Yeah.
Doctor, I'm having acne and I'm 30 years old.
I've got thick facial hair, right?
I keep lasering my hair and it keeps coming back. So these are all side effects of elevated testosterone, right?
And that's just the testosterone alone. So for whatever reason
Androgens,
you had,
okay. Right.
Okay.
So again, that's what that's a basic way of describing how your insulin is related to the testosterone. The cause of it is unknown. We know it could be genetic.
Okay.
Patients who are overweight push themselves into a PCOS situation
because
of their increased weight gain. They develop insulin resistance. Their insulin goes up. Remember, insulin goes up, the testosterone goes up.
This is why some people say you don't know if the PCOS is causing weight gain or the weight gain is causing PCOS.
It could be both ways.
But it's kind of a cycle, right? It could totally go. Okay.
And I feel bad for these patients because when they say, doctor, I really try, you know what I hear? They say, you know what? I went out with my friends last night. They're like a stick. She had pizza, she had ice cream, she had this, she had that. The next day, she still looks the same. I have a little tiny piece of bread and I gain weight. Oh. And I always tell them, well, your friend's going this way, this pathway, you're going the other way.
Right.
So you can't compare yourself to your friend.
Right.
So now that you understand the process, it's important to understand why things happen. So when I give you a treatment, then you don't question it.
Yep.
So how do we treat PCOS patients? I have a rule in my office. I say if you put it in your mouth and you say, it's delicious, it's probably not good for you.
Probably.
It has a lot of sugar.
Right.
So that's the first rule. Avoid sugar.
Okay. Avoid, and now sugar in terms of fruit too,
fruits,
like
yes, moderation.
That would break my heart, so I feel for you of that. But it is what it is.
Bread, pasta, carbs.
The good thing is too. I mean, not to go off on a tangent, but there's a lot of good options now. I mean, every year there's just more and more stuff that comes out. Like there's tortillas that are like made from almonds instead of
right.
So okay, so low carb.
So number 1, low carb diet. Number 2, exercise. I don't know if you've heard, but diabetic patients, we force them to exercise. Go for a walk after every meal. Why? Because when you exercise, let's say you have lunch and we send you to walk for half hour, 1 hour, you increase the uptake of glucose from your blood.
That cardio exercise does?
Mm-hmm.
Okay.
So it almost, the way you can think about it is the cells wake up, the receptors wake up, and they start pumping the glucose in. Okay, so it lowers your blood sugar.
Okay.
So low carb diet and exercise is a must. There's no other way around it for PCOS patients.
Okay.
So when you have a low carb diet and you exercise, what happens? Your blood sugar goes down.
Mm-hmm.
Right? When your blood sugar goes down, what happens? Your insulin goes down. When your insulin goes down, you don't store fat, you don't secrete testosterone. Okay?
So there's so far so good.
So far so good.
Right.
Now there are patients who come in, by the time they get to my office, they've lost a lot of their hair, they have acne scars, they're overweight. So what do we do with these patients? The gold standard treatment for PCOS patients with elevated testosterone is a combination birth control. Not the IUD, not a progesterone only pill, a combination birth control pill which has estrogen and progesterone.
So quickly give them like there's a few different kinds of birth control. Like
there's a combination birth control which has estrogen and progesterone.
Mm-hmm.
Then there are birth control pills that only have progesterone.
Mm-hmm.
And then we have the IUDs.
Right.
PCOS patients need to be on a combination birth control pill. Why? Birth control pills stimulate a protein, again, to make it simple, in our blood that acts like a magnet and grabs onto these free testosterones that are floating in our system, right? So by lowering the testosterone, the skin clears up, the hair loss stops, our periods become regular, right? Because the testosterone comes down and that negative feedback on the brain goes away.
Yep.
And it stimulates our regular cycles. So birth control is number 1 medical treatment.
Mm-hmm.
Number 2, sometimes you give birth control, but the patient still comes and says, but doctor, my acne is better, but it's not good. My hair loss is better, but I'm not happy about it. I'm still losing hair. So then we add a pill called spironolactone, which I'm sure you know what it is.
I've done it. It worked well for me. I've actually
Right.
suggested all the time when people ask about it.
Right.
Yeah.
So spironolactone, so birth control works systemically. Spironolactone works at the level of skin. Think of it as a cosmetic pill. It's an anti-testosterone at the level of our skin. So it blocks hair loss and it clears up acne. So that's the second treatment and it helps with facial hair, by the way.
Okay, and you would use this along with birth control.
Along with birth control.
Yep.
The third treatment is a pill called metformin. Have you heard of it?
Of course.
Yes, of course, you're a pharmacist. So metformin is a diabetic medication. The reason I go through all the process of PCOS is for patients who are trying to get pregnant, you can't really put them on birth control, right? Because they want to have a baby.
Right.
When you put them on metformin, which is a blood sugar medication, what does it do? It lowers their insulin.
Metformin is something that when you have type 2 diabetes, you go on. It's very common. It's usually one of the first ones they put you on.
Right. But PCOS patients, when you put them on metformin, their periods become regular. So if you say that to a patient, they're going to think you're mad, right? The mom, the grandma again, they'll say, wait, your GYN is saying if you take a diabetic medication, your periods will be regular? Yes.
Let the doctor be the doctor. That's what I always say. You know what I mean? Don't listen to the aunt who read a blog.
But think about it. That's why I wanted you to understand the process. You take metformin, your blood sugar goes down. Your insulin goes down, right? When your insulin goes down, what happens? Your testosterone goes down.
Yep.
And your periods become regular because that negative inhibition on the brain goes away.
I love that. That's so cool.
So these are patients who say, doctor, I haven't had a period in 4 months. I look at them, I'm like, you have PCOS. I check their androgen. I do an ultrasound. I put them on metformin, and they come back pregnant. Why? Because in order to get pregnant, you need to ovulate. In order to ovulate, you can't have an elevated testosterone. So I give them metformin, their testosterone goes down, and they start ovulating, and they get pregnant.
And now, technically, giving them metformin could also help the other symptoms they're having, right?
Yes.
I mean, it could.
So for patients who can't take birth control, there are patients who do, they have risk factors for birth control. You can't give it to them.
If you smoke, if you're over 35, right?
I put them on metformin.
Okay.
Patients that are overweight, I put them on birth control, I put them on spironolactone, and they need to lose weight, I give them metformin, they lose weight. Wow. So PCOS patients that have no other risk factors need to be on these 3 treatments, especially the ones that have, the ones that contact
the ones that,
right? So combination birth control is number 1. Metformin,
okay,
and spironolactone. If you do these 3, you can mask all their symptoms.
That's amazing.
It works like a charm.
I'm so happy for any of you watching this that suffer, because women really suffer from this.
And doctors don't diagnose them.
No, and all we talk about is like diet, which diet's a huge part of it, but this is also an important part of it.
Right.
Yeah.
So you can start with diet and exercise, but like I said, PCOS patients have a harder time losing weight. It's not like you don't eat one day, your weight drops.
And I actually empathize with that because, one little diet tip or exercise tip for PCOS is because your testosterone is a little higher. Think about men, how men react better to the weight room because they have higher testosterone. If you're going to try exercising, I would recommend weight training because you'll actually be better at it and get better results. So at least throw that in there too.
So I hope this was a quick mini lecture.
This was great.
This is what I go through with every single PCOS patient that walks into my office because, again, unless you know why we do it, I can give you a prescription for metformin. You take it for 2 days, you stop it. I give you birth control. You take it for 2 months, you stop it. But if you understand why we do what we do, then the compliance goes really high and you can actually treat these patients. So if you catch these patients early, they won't have hair loss. They will not have acne scars on their face. They will not gain a lot of weight. And remember, PCOS is the number 1 cause of infertility.
That's something to pay attention to.
Right.
PCOS.
Right. And again, these patients go to their GYN or primary care. The GYN says, well, go exercise and diet and come back. And of course, every year, 10 pounds, 10 pounds, 10 pounds. Until they're ready to have a baby and they come in and they say, well, doctor, I'm not getting pregnant. I know you're not getting pregnant. You've had 3 periods in 1 year. So instead of having 12 chances at pregnancy, you've had 3 chances in the past year. And remember, in order to get pregnant, even if you have regular cycles every single month and you have sex 3 times a week, only 50% of couples get pregnant in the first 6 months they try. 90% get pregnant in the first year, even with regular periods. So imagine if you're a PCOS patient and you're having 2 periods, 5 periods a year.
Like 1 chance, basically.
And you don't even know when you're ovulating.
No.
Do you know? So that's why it's the number 1 cause of infertility. And like we talked about, PCOS patients with infrequent periods have a higher risk of endometriosis. There's an association with PCOS and endometriosis, which majority of people are not aware of. So that's another thing to think about. But when you put them on a combination birth control, if they have endometriosis, you're also suppressing endometriosis.
This is something I'm going to say, which you probably wouldn't expect to hear me say, but I advocate a plant-based diet. I've been vegan for like 4 years. If you have PCOS, this might not be the best diet for you because unless it's high, unless you are very, very knowledgeable and like really focus on a high protein diet, I would definitely look into something that's a little more high protein. So even if you do like 80-20, 70-30, it's not for everyone.
Very good point.
Right?
Very good point.
We're interrupting her day. She's very busy, but I have a few questions on Instagram that people wanted to ask you. So we went over diet for PCOS. Again, foods that help balance hormones without being on birth control.
Any foods that will help you lose weight Again, we talked about that. And exercise.
How do you feel about adaptogens like maca? Because they help with your stressor hormones, but I don't really think they're going to help enough.
I think in moderation, it's fine. But if you think you can fix it with diet, you can't.
So, after you have a baby, can PCOS correct itself, or does it usually just stay?
It usually, for a while it can be suppressed, but eventually it'll come up again.
Okay, so it's not something that's like curable, it's just manageable.
Right.
Okay. Conceiving with PCOS we went through.
Right. Metformin is key. So if you have the diagnosis of PCOS, if you think you have PCOS, if you have irregular periods and you want to get pregnant, you have to ask your doctor to start you on metformin. And if he doesn't or she doesn't, then, unfortunately these patients do end up at the fertility doctor and then they start them on metformin, but they pay a big price tag for that appointment to get that prescription.
If someone wants to know how many surgeries are too many, like when you're going, I'm not sure what this question, like maybe what
PCOS patients don't need surgery.
I think they were referring to endometriosis from our last video, but I don't really know. I mean,
PCOS patients should not have surgery.
There's nothing.
We used to do ovarian drill. It's old school. We don't. I mean, PCOS needs hormonal and lifestyle approach for the treatment. Nothing else. No surgeries.
I think one of the big takeaways too is risk versus benefit. In medicine, that's like something you always kind of have to figure out. And I know you might want to do it the natural way and just through like natural balancing of hormones. But if going on metformin and going on birth control is going to help you have a baby and start a family, I think that benefit is higher than not taking any hormones.
And the other thing is PCOS patients tend to have mood disorders. It's common. So you need to, address that.
Do you suggest antidepressants?
No.
I don't.
I mean, it depends. I mean, obviously, if they have depression, of course, I treat, I hate to say it, but I prescribe as many antidepressants and anti-anxiety in this town as I do birth control sometimes.
Because people come to you with that?
Yes, because I act as a primary care too. But I'm just saying for PCOS patients to be aware that mood disorders are also common with PCOS patients. The most important thing is these patients are at risk of diabetes in the future, heart disease, metabolic syndrome. So it's important. That's why the diet and lifestyle is key, and it's a lifelong battle with PCOS.
So even if, let's say, you don't have the weight gain, but you have the acne and
which is possible,
still focus on the diet and exercise because you have a higher risk of diabetes later.
Patients with insulin resistance have a higher risk of diabetes and heart disease in the future. And patients who have PCOS, they're very overweight, and they're not on birth control, so we don't cycle. They don't go through the menstrual cycle every month. They're at risk of uterine cancer. So patients that are very overweight and they come in and they haven't had a period in a year, it's always good to do an ultrasound and check their lining because you want to have them shed that lining. So even if they refuse to go on birth control pill, you can even put them on monthly progesterones for 10 days out of the month, and that will stimulate their period so you can get rid of that uterine lining and you lower their risk of uterine cancer. Because remember I talked about overweight patients tend to have a higher estrogen level.
Yes.
And when you have a higher estrogen level, it's an unopposed estrogen effect on the uterine lining, which increases your risk of pre-cancer of the uterus and which is hyperplasia, and eventually uterine cancer. So by losing their weight, by taking metformin, by taking birth control, they can lower that risk. So that's another issue with PCOS patients.
That's, maybe at the bottom of this video I'll link like a little PDF of diet tips for PCOS and just little lifestyle things you guys can do. Thank you so much. This was such a great video. I'm so happy that you guys get to hear this from one of the best. I'll put her Instagram on here. I don't know if you guys want to ever reach out if you're in LA, but if you have any other questions, leave them at the bottom of this video. Maybe we can get you to answer some. All right.
Great. No problem. Take care.